So we're joined now by the Senior Fellow at Policy Exchange, Jean-André Prager, joins us now. Good morning. So your overall assessment of this decision?
I think it's probably a necessary step. Whether it's deficient, I think, is still to be seen. As I think has been pointed out this morning, it's a relatively small amount of number given the overall increase in the benefits bill over the course of the Parliament. However, I would say it makes the right structural changes, I think, to the benefit system, especially around trying to move the system away from showing what people cannot do to trying to show what people could do, and I think that's an important shift that needs to happen.
Do you think part of the problem here has been that we've put more focus on mental health, which is not necessarily a bad thing, clearly, with the rates of people taking their own lives, particularly men in this country, but that has swung the pendulum so far that actually those with genuine physical disabilities, particularly those in wheelchairs, etc., can't then are being lumped together with people who, frankly, are swinging the lead?
I think, as you've pointed out, the PIP benefit system hasn't been updated for over 10 years, and similarly with ESA and the work capability assessment in universal credit. And so society's changed over that time, and the benefit system has not. So I think there's a misalignment there, and it needs to be rectified. And I think some of the steps yesterday the government took, are the correct steps to try and realign that.
And how important is it, in your view, also, that people who particularly are on PIP have their claim reviewed? And it should be face-to-face rather than a telephone.
I think this has been a major challenge, especially since COVID, when these assessments were done purely over the phone or paper-based. And I think
they can't be properly done.
I think that the issue is that we need to make the assessments more objective, and they become increasingly more subjective. And as you know, they're a functional assessment in and of itself. So you need to try and create a more objectivity in the system. And so I think returning a lot of these assessments back to face-to-face is very important. And you'll have seen the data recently shows more and more assessments are being done either over the phone or online or paper-based.
Yeah.
Are you surprised at how many people, hundreds of thousands of people getting PIPs, are getting it because they're obese? Is that
No, I think it's fundamentally the issue around the assessment process, which is it's a functional assessment.
Yeah.
And so that, I think if you look at it that way, I think it goes back to we need more medical evidence, we need more objectivity in the system, but ultimately that is the way the system is designed. It is a functionally based assessment, so if you cannot carry out some functions, then you get the additional financial support.
Have you made it too easy?
I don't think. I think the changing nature of society has happened over the period. I don't think it's as clear cut as they've made it too easy. They haven't made it, but I just don't think the system has adapted properly to the changing nature of our society, and that's why the changes are necessary.
Yeah, I think that's really interesting, because I think they've made it too easy for some people who don't necessarily deserve it, and then made it too difficult for people who genuinely do need assistance, and that is what the welfare support is meant to be for.
I agree with you, and I think actually this is why, again, a number of the reforms they take are quite good. One, to stop certain reassessments for some people with lifelong conditions, severe conditions that will never change, and that's something the previous government looked at quite a lot, and I think that's definitely a right step. But also to make it slightly more difficult for certain cohorts of claimants, and I think that's right. I think it's not about individual entitlement per se being cut. It's about looking at the cohorts and making sure we're helping the people that most need the help.
Obviously, the younger people are now claiming more benefits, particularly sickness benefits, since the pandemic. Why do you think that's happened?
I think it's very difficult to put one reason behind it. I think there's a number of issues. I mean, people have talked about the effects of COVID quite a lot. Also, I think it's a changing nature of society. I wouldn't go as far as to say people are committing like quote-unquote fraud, but people are much more aware of the system, how to claim these benefits. And I think, again, once the system has been around for quite a long time, people are just more aware of how it works, and that does drive behaviours. And I think the policy announced yesterday about 20 people who aren't 22 not being able to claim capacity benefit is a good first step. Again, it is a relatively small number of claimants. So it's about 66,000 claimants. So again, it kind of.
But that's too much.
But I agree with you, it's too much. But again, it just shows the scale of the challenge that the government's going to face. While it's it's quite a small amount of money given the overall bill and the overall challenge the government faced.
Yeah. OK. Fascinating.
Really
Thank you, Senior Fellow there at the Policy Exchange, Jean-André Prager.